Opioid use disorder, or OUD, is a problematic pattern of opioid use that causes significant impairment or distress. Opioid use during pregnancy is not uncommon. In a 2019 study, 7% of women reported using prescription opioids as pain relievers during pregnancy. However, 1 in 5 of those women also reported misuse, meaning they received the opioids from a source other than a healthcare provider, and used them for reasons besides alleviating pain. As a result, the mother and the baby are exposed to adverse health outcomes such as maternal death, poor fetal growth, stillbirth, or specific birth defects.
We know that opioid use disorder is something that cuts across all demographics. So it doesn't affect rich people or poor people or middle income people. It cuts across all racial and ethnic lines. So all people in the United States are affected. So it's truly a public health issue, including moms and babies.
MATlink is a surveillance system that monitors maternal, infant, and child health outcomes associated with treatment for opioid use disorder during pregnancy. There are currently 4 clinical sites that will share data they collect on maternal and child health outcomes associated with OUD treatment. These data will help improve policies, clinical practice recommendations, and clinical decision-making for OUD treatment. In addition, the MATlink system will pilot a data platform to securely collect and link maternal, infant, and child data across the clinical sites, which can later be modified to collect data on other exposures during pregnancy.
Boston Medical Center is one of the clinical sites participating in the MATlink project. At Boston Medical Center, we specialize in the care of pregnant women with opiate use disorder and infants with neonatal opiate withdrawal syndrome. We have a specialized obstetrical and pediatric program that's designed to support these families. We see about 100 new families every year, and we collect a lot of really important data that helps us to better understand the outcomes of these dyads.
We are very excited to be a part of this. Our role has been, we were selected as one of the sites. We've been participating in piloting the data, having conversations for data homogenization with the other 4 sites, and that's been really informative and helpful as we have 4 different models of care, and sometimes we collect different data points, so it's been really great to do that process with the other 3 sites.
It is very important for us to be part of this project, as we have been caring for the mother-infant dyads affected by opiate use disorders for over a decade now. Unfortunately, Ohio is among one of the states that were most impacted by the opioid epidemic. This has resulted in an increasing number of infants that have been born after being exposed to opiates while inside the uterus, resulting in the diagnosis of neonatal Addison syndrome and/or neonatal opioid withdrawal.
We're really excited to combine our data with other leading sites from around the country in order to develop a really robust data set to better understand the impact of maternal opiate use disorder in pregnancy on both maternal and infant outcomes. I think the MATlink project will be the first surveillance data set that's not based on administrative data, but rather on very detailed chart review and abstraction, which will contain a level of detail that just simply has not existed before. This will help to address a lot of gaps in knowledge and address some of the confounding that exists in other data sets, and will really help us to guide clinical practice for these mother-infant dyads.
And so what we are really excited about with MATlink is that we're going to get prospective data with follow-up for 2 years across the country. And it really, I think, is going to be something very helpful, because we're going to be able to see both geographic trends and temporal trends for something that's affecting the entire country.
Unfortunately, robust data to guide best practices and evidence-based recommendations for the care of the mother-infant dyads affected by opiate use disorders is lacking. This multi-institutional data collected as part of this very important MATlink project will help to gain a more thorough understanding and to guide evidence-based recommendations that will allow us to best counsel and care for the mother-infant dyads that have been affected by opiate use disorders.
What I'm excited about is that we're putting in a tremendous amount of work. Both the CDC, PHII, our partners at the different sites are putting in a lot of work to be thoughtful about how this can serve as both the information that we're getting about moms and babies with opioid use disorder, but how this partnership can be used as a model for other different exposures, whether that's drugs or infectious disease like COVID or other things that come up that we can't even anticipate.